Hello, good morning, good evening, everybody. I am Dr. Asavari Manvikar from Minnesota, USA. I would like to welcome you all to the GCAR Global Webinar Research Series. Global Council for Ayurveda Research is an international non-profit organization based out of USA with a sister chapter in India by the name of Ayurvidya Anusandhan Abhiyan Foundation, AAAF. Our mission is to encourage, educate, and facilitate basic, clinical, and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at Ayurveda, www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. And no nonprofit can operate and succeed without volunteers. So consider joining us as a volunteer, and we can place you in a variety of projects based on your research and your skills and your interest. Once again, our website is www.ayurvedaresearchusa.org. Now, I would like to introduce you to our eminent speaker, Dr. Nitin Kochar. He is MD in Kaya Chikitsa, and he has been working in this field since 1995. He has significantly contributed to the field of Ayurveda. We are very happy to host him today. He worked as an honorary consultant at KEM Hospital, Parel, Mumbai, till 2015. At Health Center, University of Mumbai since 2009, and honorary Ayurveda consultant at Srimati K.G. Mittal Punarvasu Ayurveda Hospital, Mumbai. He is a recipient of prestigious Sandhu Dhanvantari Award for the year of 2015. He received Times Leaders in Healthcare Award 2020-2021. He has done incredible contribution to the field of research. He worked as a chairperson in one of the sessions in the symposium held by ACTREC, Tata Hospital, on integrated traditional knowledge with evidence-based medicine on 26 September 2023 at Kharghar. He worked as a chief Ayurveda investigator in clinical trials conducted at Tata Memorial Hospital and Research Center of Cancer. Efficacy and safety of curcumin formula and ashwagandha in osteosarcoma. Role of cannabis in perioperative breast cancer and head and neck cancers. He worked in Akworth Leprosy Hospital, Vadala, Mumbai through their ACT program. He has been practicing as Ayurveda, diet, yoga, and Panchakarma consultant at Goregaon West, Mumbai since 1995, and he started dedicating his work to cancer management since 2005. He served as scientific secretary since 2015 to 2023, and now he is a president at Goregaon Medical Association 2023-2024. He has delivered many lectures on various scientific national and international forums on evidence-based scientific role of Ayurveda in managing various chronic diseases and cancers. He has done many publications and presentations at various symposiums and institutions. At Ayurveda clinic trials in cancer, he recently did a presentation which was at Orlando NCAM conference in USA in October 2023, evidence-based integrated management of cancer, relevance of ancient medical and social ethics in the contemporary era, evidence-based management of IHD, by Ayurveda. Efficacy of curcumin and inospora as adjuvant in the management of tuberculosis along with AKT. Evidence-based management in SLE, asthma, COPD, pain management by Ayurveda. In rheumatoid arthritis by Ayurveda. Efficacy of Boswellia in osteoarthritis. So he has done many publications as well as presentations internationally, nationally. We are very happy to have you today. We would love to you to start and take it from here.
This one? This one? ये लेना है ना screen.
Hello, everyone.
Hello, am I audible, ma'am?
Yes, you
Hi.
are.
Yeah. And is my screen, the presentation, you can be visible?
Yeah, absolutely.
In proper mode.
So
It's a
thanks a
full
lot.
screen. Thank you so much.
Thanks a lot to the council, Dr. Asavari, Dr. Pratibha, and all my friends, respected Rajan Patankar sir, Dr. Lal Hingurani sir, with whom we have worked together in Tata Memorial Hospital on curcumin, ashwagandha, and other products. So my sincere thanks to you for giving me an opportunity to interact with you all intellectual people and interested in Ayurveda. So as the name goes, the name of my talk today is evidence-based management of cancer by Ayurveda. Now here one thing has to be kept in the mind. We do accept evidences of modern science, but at the same time, the principles of Ayurveda should not be forgotten while treating the patient. If we only run after the modern evidences, okay, and treat the patient based on those modern evidences, treatment will be a big failure. So this has to be kept in the mind. Curcumin, yes, is effective. Ashwagandha, yes, is effective in cancer. But you have to use it based on principles of Ayurveda. That's what we are going to see, and that will be a real integrated treatment. Okay, so let us start with that. Next. Yeah. So my sincere gratitude to late Vaidya Shri Lata ji, late Vaidya Shri Goradia ji, Vaidya H.P. Sharma ji, Vaidya Rakesh Sharma, Vaidya Ranawat, Dr. Ashish, Dr. Vishwajit, my friend, Dr. Nitin Goradia, Dr. Hina Bhatt, who is practicing in USA, my Goregaon Medical Association committee members, my family members, especially my son, who has helped me a lot to prepare this PPT, and I'm in front of you because of his efforts only. My patients, above all, Lord Dhanvantari. These are all my Ayurveda colleagues and teachers. From modern doctors, I am blessed that I got an opportunity to be Dr. Devchan Gana, who is my teacher. He is MBBS and he is doing pure Ayurveda practice. Dr. Ashok Vaidya sir, he is one of the pioneers of clinical pharmacology in India. Okay, and I'm really blessed that I got guidance from him. Dr. Nilima Kshirsagar, ex-DN, Dean KM Hospital. Dr. Nirmala Rege, again, she is a professor from KM Hospital, now retired. Dr. Banavali sir, who is a director at Tata Memorial Hospital now. Dr. Manish Agarwal sir, I cannot forget this person because we started our first project under his leadership on curcumin and ashwagandha in osteosarcoma. Dr. Pankaj Chaturvedi sir, Tata Memorial Hospital ENT, Dr. Vikram Gota, Dr. Shalaka Doshi, she is a breast oncologist, Dr. Lal Hingorani, Director Pharmanza Herbals. You know, I have a lot of ideas, but if I do not get good quality medicine, my all ideas will be futile. There will be no result. And I am indeed thankful to Dr. Lal Hingorani sir for providing me in non-interrupted the supply of the herb, standardized herb. Okay, and that's why we are able to get the good quality result. Dr. Manu Lopez, with whom I am working on the gold nanoparticle, and the results are also encouraging. Money. Dr. Mitali Mukherjee, with whom I am going to work on the Prakruti-based models and cancer. And I must thank Dr. Syed Tahir Hasan for training me on cannabis. So without this slide, I will never pass on again to the next slide. My sincere gratitude to all these people, and let us move on. These are the bibliography, these are the journals from where I have got all modern evidences for the principles of Ayurveda. Okay, these are all well-renowned journals, PubMed indexed journals. These are all latest journals, not very old. Like, the Lancet and JAMA, these are all standard journal having a good ranking number. Now, friends, what is the current scenario? Yes, cancer cure rate is increasing. As per the present data, 70% is the cure rate, but only if it is diagnosed early. Otherwise, there is almost 1,500 deaths per day. This is American Cancer Society data, and or equal number of deaths per day. This is Indian National Institute of Cancer Research project data. And friends, more than 90% of the death in cancer is due to relapse, metastasis, spread, and not due to primary tumor. So if someone is lucky, diagnosed early, immediately diagnosed early and treated promptly, yes, he or she may be cured. But that is the whole story. It is very difficult to diagnose the cancer at early stage. So most of the patients, those who come to us or to the modern oncologists, they are in the late stages. Okay. So what will be the role of Ayurveda is to prevent this 90% death. We are not interfering into chemotherapy, surgery, radiation, or whatever modern treatment is being given. Our role at present is to prevent this 90% death which is occurring because of the relapse. Okay, so what I call my treatment is a onco-preventive treatment. At one point of time in future, this onco-preventive treatment will also have a chemotherapeutic kind of effect. But at present, based on whatever data, based on the studies what we have, so this treatment can be called as an onco-preventive and can be given as an adjuvant treatment to all the cancer patients. Let us see. Why should I say this? Now, this is from the seminars in the Cancer Biology, February 2020 recent journal. So there are chemotherapy, yes, is very essential, but it has got paradoxical effect. At one hand, chemotherapy does kill cancer cell, but if you see on your right hand side, because of the chemotherapy itself, inflammatory cytokines are stimulated, because of which these bone marrow myeloid cells are recruited at the primary site. It increases chemotherapy, increases vascular permeability. Those cells which are not dead because of the chemotherapy, they serve as a cancer stem cell. Because of this inflammatory cytokine, because of the cancer stem cell, again there is a relapse, this grows. Plus, chemotherapy also helps to improve tumor microenvironment, TME, tumor microenvironment, favoring metastasis. This has been documented. Plus, at the target side, again, chemotherapy damages the tissues, healthy tissues, immunity is reduced, and cancer cell they grow. So these are the three other side of the chemotherapy. It promotes cancer stem cell, it promotes tumor microenvironment, it promotes bone marrow myeloid cancer cells, recruits cancer cells at the primary site. It increases vascular permeability, because of which this cancer stem cell they leak out, they go into the vessel, and from vessel again they spread to the other healthy tissues. And tumor favoring inflammation at the target area, distant target area, there is a inflammation because of the reduced immunity. Body wants to destroy, so body generates inflammation. So this inflammation again favors the metastasis. So these are the three major things because of which cancer becomes chemo resistant and there is a relapse. It doesn't mean that we should stop cancer treatment or chemotherapy treatment. You must, but this problem can be addressed by adding our Ayurveda treatment. This is what I spoke just now. So is what is written in Ayurveda? Anu hi bhutva rogam paschat vivardate sa jata mulo mushnati balam ayushya. So in Ayurveda also it has been emphasized that you should diagnose case early. If not, patient will die, the strength will reduce. What Lancet Oncology say about the adjuvant treatment? Okay, so primary chemo prevention to be done at high risk individual. You screen the patient, those who have genetic history. You screen those patients, find out the markers. So they are high risk individual. Change their lifestyle. Incorporate certain herbs like you can turmeric and other herbs you can start them. So these are high risk individual. Can you put it down? Yes, this will go down. No, this will not go down. Okay, okay. No, no, no. Yeah, no, but no. So high risk individual and healthy subjects. Put it down further. और कब नीचे वो दिख जाएगा अभी गया था हाँ so high risk individual and healthy individuals okay after screening modification of the lifestyle ask them to do proper diet exercise this is the first stage this is also chemo preventive secondary chemo prevention patients with pre-invasive dysplasia somebody has come to us with the leukoplaque somebody has come to us with the cervical lesion okay so these are second patients with pre-invasive dysplasia you treat them and at the same time you can also add your Ayurveda treatment as an adjuvant treatment and third is tertiary chemo prevention successfully treated cancer patient to them in order to prevent further relapse and metastasis you give adjuvant chemotherapy so again this is an evidence based and Lancet didn't say to give curcumin and ashwagandha. Lancet has used this word as a chemo prevention. I am using it for my science, for our principle. So this is a principle what we can implement in our practice legally. Can we use Ayurveda legally? Do we have any rights? Let us see what WHO says. So traditional medicines of proven quality, safety, and efficacy contribute to the goal of ensuring all people have access to care. Friends, there are almost 35,000 herbs are screened and 3,000 herbs, they have reproducible anti-malignancy or anti-cancer properties. 3,500, huge number of drugs herbs we can use in clinical trial and we can prove their safety and efficacy is already proved and use it in our day-to-day practice so WHO former director general Dr. Margaret Chan she said that traditional medicine of proven quality safety to be used as an adjuvant or as a part of your integrated treatment. WHO strategy for 2014-34 are to support member states. So we all are member of WHO that harness the potential contribution of traditional medicine for wellness and people-centered health center. So it applies to all the diseases, diabetes, blood pressure, including cancer. Integrating traditional medicine and practitioners into conventional health system and national policies where appropriate you have to use. So I think this is also goal of your council and your institution, Dr. Asavari and Dr. Pratibha madam. So this fits into even the guideline provided by WHO. Now, when I haven't spoken this, so my topics will be integrated understanding of cancer pathology, clinical trials at Tata Memorial Hospital. This part will be covered by Dr. Lal Hingorani. I will also talk, but major part will be covered by Dr. Lal Hingorani and my clinical experiences. So, coming to the root cause, what is the cause of cancer? We all feel that genetic is the cause. Yes, genetic is the cause, but there is a difference between inherited genetics and acquired genetic deformities or acquired genetic pathologies. Friends, as per the number of studies published, almost 90% of the cancer is genetic pathology is because of the environmental damage. Only 10% they have inherited cancer gene. Now, having cancer gene also doesn't mean that person is going to have cancer unless he is exposed to wrong environment. When I talk about wrong environment, so it comes wrong diet. 35% is the cause. Tobacco, almost equal. So wrong diet is equal to your tobacco chewing. infectious diseases 15 to 20%, obesity, which is now increasing 20 to 30%. So this gene damage, the DNA damage, is because of the obesity, alcohol, diet, wrong diet, and tobacco. You can see only 5% is having the genetic lineage inherited, which causes cancer. What Ayurveda says, cancer is a low-grade inflammatory disease. Shothajanya, but low-grade inflammatory disease because of the improper or no panchakarma, prolonged fasting, prolonged illness, excessive salty, sour, heavy food, excessive sweet, excessive food which is rich in the fat, curd, improperly cooked food, non-compatible combination, infected food, toxic substances. So the toxic substances means all alcohol, smoking, pesticides, plastic, your dyeing, coloring agent, everything comes under Garavisha in Ayurveda, what we call. Okay. And even no exercise, Thaulyam, Grahani. So microbiota, if it is imbalanced, if there is no proper microbiota in gut, that also leads to inflammation. That inflammation may cause cancer in a genetically predisposed person. Abnormal deliveries, multiple abortion, and low immunity. So these are the clear cut. We can see that whatever modern science has been telling has been already described or prescribed in Ayurveda. Again, even if cancer susceptible variant is present, can you go down? Yes. It doesn't mean that necessarily that everyone who inherit the variant will develop cancer. So this is a fact sheet from National Institute of Health, National Cancer Institute from USA. So cancer susceptibility gene, when coupled with environmental factors, will cause cancer. See, what is written in DNA mutation may not be the cause of cancer. This is again in the journal 2017. And cancer, then what? Then cancer as a metabolic disease. Moment I say cancer as a metabolic disease, my confidence level increases because I can control metabolism. It becomes difficult to target gene. It is difficult to target gene even by cancer causing environment factors because gene is encapsulated in a very, very strong vault. It is not easily exposed. But other parts of the cell which control metabolism, which we will speak about, are easily susceptible to get damaged by environmental factors, which we spoke about. So even now there is a thought process that DNA mutation may not be the cause of cancer and cancer to be considered as a metabolic disease. So DNA mutation, because of the wrong environmental factors, cancer is the guilt. Now, if you see here, good. So reduced quantitative and qualitative mitochondria cause oncogenic process and progression. As I said that in a cell, there is only one nucleus, but there are a number of mitochondria, 400 to 4,000 mitochondria are available. These mitochondria, whenever we start eating food, they become larger, bigger. But in cancer predisposed person, what happens? This mitochondria fissioning is happening. This mitochondria becomes smaller and smaller because of the hypoxia, because of the chronic inflammation, because of the mitochondrial DNA damage, because of the antibiotics, because of the pesticides, because of the excessive production of the reactive oxygen species, that is free radical, because of the abnormal microbiota, there is an increased mitochondrial fission. Okay, this actually gives wrong signal to the nucleus and it turns the normal cell to the oncogenic transition. So you can clearly see that disturbed or dysfunctional mitochondria initiates the cancer or oncogenic process. It will be clear in our next few slides. So damaged mitochondria, which will cause abnormal oxidation phosphorylation. Okay, there is a reduced catabolism, less amount of ATP is produced. Okay, whenever we eat food, the oxygen and glucose enter into the mitochondria, oxidative phosphorylation occurs. Okay, body produces ATP, that is our energy. Body produces raw material. that is amino acids, nucleic acid, and fatty acid. So these are the two metabolic actions are going on: catabolism, anabolism. So in a normal cell, one glucose molecule produces 40 molecules of the ATP, and it produces amino acids, nucleic acid, and fatty acids. Plus, it also produces heat. It also produces free radicals, carbon dioxide and water. Carbon dioxide and water are excreted. Heat is very essential to burn the inside dirt and the fat. In cancer, what happens is because of the smaller mitochondria, they produce less energy. So they produce less energy. This slide is very essential to understand. They produce less energy, but they produce more amount of amino acids, nucleic acid, fatty acid, and there is a reduction in the thermogenesis. What I mean. Okay. In cancer cells, what happens, or in a pre-cancer stage, what happens? Mitochondria produces more amount of amino acids, nucleic acid, fatty acids, and less amount of ATP. Now, mitochondria and nucleus, they are into signaling system with each other. Mitochondria gives signal to the nucleus that it has excess amount of fatty acids, nucleic acid, and amino acid, which triggers nucleus to a higher metabolic rate, which proliferates the cellular proliferation, because it has to use all those produced amino acids, nucleic acids, and fatty acids. There is a less production of the heat. So this heat also is not able to burn excess amount of fatty acids and other free radicals. And overall, the oncogenic process starts. Your P53 molecule is suppressed, your all kinases are stimulated, and your cell cycle of GS1, S2M is uncontrolled, and there is uncontrolled proliferation till all this produce metabolism, anabolic material is being used, and abnormal cells form. Now, in this process, these cells, they produce lots of lactic acid. This lactic acid surrounds the cancer cell, because of which your immune cells are not able to hit. They are not able to kill that. And it grows very slowly. That's why there is no inflammation. What Ayurveda says, cancer arbuda is apak. There is no pus formation. It's apaki granthi. Okay, this is what written in Ayurveda. It's low grade inflammation. So your immunity is trying to kill. Because of the lactic acid, it is not able to kill it. Because of the uncontrolled P53 is not working properly, so it will not do the DNA repair. It will not stop the cell cycle. Okay, and all cell kinases, cyclin dependent kinases and isokinases, all those kinases will trigger the cell cycle and multiplication will happen. So this is how the cancer process initiates, because of the damaged mitochondria. It has been proven that it is clear that biology of mitochondria in cancer is essential to our understanding of cancer biology. This is again from the Cell Journal. So these are the 6 stages: initiation, growth, survival, and metastasis. So mitochondrial support is very essential for tumorigenesis. So oncometabolites production, signaling factor, oxidative stress, change in the permeability, everything, metabolic reprogramming, everything is because of the damaged mitochondria. When I say that we are giving you onco-preventive treatment, so we are actually trying to prevent the initiation, growth, and the survival, or the progress and the metastasis. Here our roles come. This tumor cells, accumulated tumor cells, produce tumor cells. They have to be cut off by surgery, or burnt out by the radiation, or you have to kill with the help of chemotherapy. But in order to arrest the cancer process, unless and until you improve mitochondria, this will not happen. This is what my hypothesis and what I'm practicing. Now, this thing was tested one scientist from Orlando itself. He has done this and published in Carcinogenesis 2014. So as you can see, this is the normal cell, this is the abnormal cell. Okay. What they did in the normal cell, if we say that cancer is because of the abnormal gene or nuclear pathology, so the cancerous nucleus they inserted into healthy cell. If cancer is only because of the nucleus, abnormal nucleus, then this cell should become cancerous. It didn't become because of the healthy mitochondria. So this was one proof. Second, in a cancerous cell, they inserted healthy nucleus, but mitochondria were abnormal. That's why this cell didn't become normal. So again, that proves that it is only nucleus has got no role in tumorigenesis. It has to be coupled with abnormal mitochondria. This trial was done somewhere in 2010-11, published in 2014. Again, it was repeated and it was published in 2021 or 22 journal with the same result. Okay, so this proves that mitochondria play a very pivotal role in cancer. So cancer as a metabolic disease implication for novel therapeutics. So if I treat mitochondria, I can arrest the cancer growth. The results suggest that tumors do not arise from nuclear genomic defects alone, and the normal mitochondria can suppress tumorigenesis. A big sentence. So you treat mitochondria and you see that whether cancer can be suppressed or not. So mitochondrial dynamics are clearly implicated in all the hallmarks of the cancer cells. There are 6 to 8 hallmarks. In all the hallmarks, cancer grows because of the abnormal mitochondria. Crosstalk from non-cancerous mitochondria can inhibit tumor properties of metastatic cells, suppressing oncogenic pathways. So in a tumor, there are healthy cells are also there. That's why many a time you do biopsy or FNSC, many a time it comes negative. There are a number of healthy epithelial cells are there which are not yet gone to the mesenchymal. So if number of healthy mitochondria origin cells are there, that cancer can be cured easily. That cancer will respond to the chemotherapy in a better way. But if abnormal mitochondria are more, that cell will be resistant. That cancer will relapse again. Okay, so now these people are trying to do mitochondria organelle transplantation. Probably that will be a future line of treatment. Okay, till then we can see that what Ayurveda can do to restore the mitochondrial function. So, as I said, if they have a more number of abnormal mitochondria, so this cell will be chemoresistance, and if they will have a bad tumor microenvironment. Okay, so retrograde signaling from mitochondria to the nucleus will continue, and there will be chemoresistance. Okay, if there are more number of abnormal mitochondria are there in the cell and in a tissue. So, friends, what is the mitochondria? So, mitochondria is a share chat button. Yeah. So, are mitochondria and Agni same? Mitochondria is required for everything, for the your birth to the cell death and cell function. Even in our what in written in Ayurveda that Agni and Agni is also have a maternal inheritance. Mitochondria is inherited through X gene. Okay. In Ayurveda, it is written that Agni is inherited only through mother. Artavam Agnayam Shukram Saumyam. There is no mitochondria in the head of the sperm. Mitochondria is there in the neck. Neck doesn't take part in the fertilization. So Artavam Agnayam. Here also we say that modern science is saying that key mitochondria are only inherited to the X chromosome. Okay. So one thing is proven. Both have same maternal inheritance. Both are responsible for cellular function. Both are responsible for all kinds of cell survival, death, and both are responsible for all kinds of cellular function, health, and diseases, including cancer. So, Ayu Varna Bala Swastha Utsaha Upachayo Prabha. This is what shlok of Ayurveda. That your life, your glow, your all aura, your health, your energy, your vitality, your body contour, all these things are responsible or are dependent on the Agni. Shante Agno Mriyate Yukte Chira Jivati Anamayah. If Agni dies, if Agni, there is no Agni, that means Shante Agnomrita, that person or that cell will die. Yukte Chira Jivati Anamaya, if Agni is robust, the person will have healthy life. Okay. Rogi hi syat vikrute. But if Agni is abnormal, that person will become rogi. Okay. So abnormal Agni, if dies, that disease will be cured. But abnormal Agni continues, patient will become cancer. And that is what is happening. Mitochondria, dysfunctional mitochondria, unless and until you remove this dysfunctional mitochondria and produce healthy mitochondria, cancer will not be cured. So you have to actually give a treatment which will kill this abnormal mitochondria. In Ayurveda, we call Pachan Chikitsa. There is another treatment called Dipan Chikitsa. Pachan means one which the toxins which are produced because of the abnormal Agni we call Ama. Because that Ama is removed and abnormal Agni is also removed, and by Deepana, normal Agni or healthy Agni is again being, restored. So this is what somehow you can do correlation. So Pachan Chikitsa and Dipan Chikitsa are very essential to improve Agni function. So if I say Agni and mitochondria are same, so same principle, same treatment should apply and should be useful for mitochondria, the Pachan and Dipan Chikitsa. Let us see whether I am right or wrong. So again, as I said, Rogaha sarve api mandegno bhaveta charak sanhita. This is what Ayurveda says, okay, thousands of years ago. Now, when modern science are saying that damaged mitochondria are responsible for metabolic diseases like diabetes, obesity, cancer, okay, degenerative diseases, cell stress, for everything, this abnormal Agni is responsible. Integration of modern and Ayurveda pathogens of cancer. So, what Shat Prakriya Kal we say, there is a okay, so there are 6 stages like Sanchay, okay, accumulation, Prakopam, it increases, Prasara, spreads, Thana Samshraya, Vyakti and with most of you are Ayurveda doctors, so I need not to explain. So in modern terminology, this is called accumulation of oncometabolites. Loss of tumor suppressive function is Prakop. Prasar means unlimited proliferation. Sthana Samshraya means invasion and colonization. Vyakti means expression, and Bhed means extensive spread. Mostly patient comes to us at invasion colonization space, at that stage they come, and otherwise they come here whenever there is an extensive spread. Okay, so this becomes difficult. If you can pick up patient here, okay, at the first stage itself, so Sanchay, Prakop, Prasar, okay, Lakshan, if you know and if you can pick up, you can treat the cancer. Friends, you will be surprised. Like we use word oncologist. Sushruta, there is a word used, Arbudatnyaha. Sushruta, which was written 500 years before the Christ, he has written word Arbudatnyaha. So he said, these are the symptoms written by Arbudadnya. So what are those? Gramya Ahara. Okay, because of eating, all sweet and heavy food, what I said, there is a Samurchit Manda Dhatu Agni is Manda, Janya Shotha Nirman, and it Agni Mandya causes Dhatu Vruddhi. What I said, abnormal mitochondria, low mitochondrial function produces more amino acids, more fatty acids, nucleic acid, and the raw material is produced more. The same concept written in Ayurveda, Agni Mandya causes Dhatu Vruddhi. Okay, Dhatu Vruddhi Mahantama, Analpa Moolam, which keeps on growing inside. It has got deep root. Why? Because there is a constant blood circulation is increasing. Blood vessels are increasing. There is an angiogenesis. I have tried to, correlate these modern hallmarks which are published in Journal of Cancer Discovery 2020, American Cancer Guideline. So these are the hallmark written that non-mutational factors, epigenetic, infection, diet, metabolic reprogramming, this is the new hallmark, uncontrolled growth, angiogenesis, replicative immortality. Cancer cells do not die. What is written in Ayurveda? Vruttam, sthiram, chira vruddhi. So they are round. sthira, they are immobile. Where cancer growth is immobile, very, very stubborn. And chira vruddhi, what we say when you bless someone, chiranjeev bhava, don't die. Okay, so the word used here in this shotha only, in other shot, chira shabda has not come. Chira vriddhi. So replicative immortality. Apakam, it will not ripen because of the immune evasiveness. Okay, non-acute response. Then the arbudam, dvi arbudam, kalantara asadya. There is a invasive metastasis and relapsing chemotherapy. So if there is a cancer occurs at the same place, it is called adhyarbud. If the same cancer occur at two different places, it is called dviarbudam, either at the same time or after some time. So concept of metastasis is also clearly written in Ayurveda, and it is also written that when it goes to this stage, it becomes asadhya. Then there are phenotypic plasticity written in modern science. So that's why we are nowadays doing genetic testing to see that which genetic and which kind of drug patient will be responding. So similarly, we have to examine Vat, Pitta, Kapha. What I have observed, if you give curcumin in a high dose to a Vata Prakruti patient, there are side effects. But a Kapha Prakruti patient and Pitta Prakruti, Kapha Pitta patient, they follow crop, they are able to tolerate. Vata Prakruti patient, when having kapha, he will have a better effect of ashwagandha. But vayu and pitta, if you give high dose of ashwagandha, which I am using, they get side effects like rashes or itching or heat. So these are things, which we have to keep it in the mind while giving the treatment. Simple tinospora, that is giloy, causes constipation if patient is of vata prakruti, wherein pitta and kapha prakruti patient, they tolerate very well. So you have to, divide, you have to have proper protocol based on the prakriti, and this is what I am interested to work with Dr. Mitani Mukherjee in future. She has developed beautiful models of prakriti. Okay. What is written in Ayurveda about Chikitsa Karshan? First, you remove. So this is surgery, is written in Ayurveda. Shastra Karma. Karshan means to reduce it, debulking it. By various ways, by giving medicines or this, that, you reduce the tumor. Shastra Karma, to be done by an expert. This is the word used. Agni Karma, you burn the local area. Okay, so that is Agni Karma, same as a radiation, and give treatment which will improve the immunity. So these are the four protocols of the treatment written in Ayurveda which we have to use. Now, when I say Karshan Chikitsa, it also indicates Pachan Chikitsa. Now, coming back to my slide where I said Pachan Deepan Langhan, let us see whether these principles can correct the abnormal mitochondria, and do we have any kind of modern evidences for that. So emerging evidences for targeting mitochondria, again, I'm connecting the dots that mitochondrial treatment is very essential. This is what is written in these journals. So the herbs we know which are acting on Agni are what? First of all, no drug, that is fasting. Langhan Chikitsa. Ginger, piperine, chitraka, garlic, every second year student will tell you that the drugs which are responsible for pachana, which are responsible for dipana. So all tikta rasatmak dravya like kalamega, andrographis paniculata, tinospora, curcuma is also tikta kashaya, vidanga. So these are all pachan drugs. Ashwagandha is also tikta, but ashwagandha is guru gunatmak. So we do not use for pachan, we use basically for improving as a rasayan chikitsa. And of course, cannabis also is used, which I will explain how I use and what are the effects of that. So fasting, ginger, piperine, chitrak, garlic, bhallataka, all these are drugs which act on Agni. Then there are various herbo-mineral and metal preparations are there. As I said, I'm also working on the gold nanoparticle, and I will share my some experiences with you. Now coming, the first thing is fasting. Pratibha madam, just let me know if I'm overshooting the time.
No, you can continue, Dr. Nitin, please.
Thank you, madam.
We will extend the session today. We will extend the session today.
Thank you, ma'am. Thank you.
Thank you.
So we all Indians are doing fasting for ages. Okay. Okay. And the Nobel Prize for the fasting was given in 2015. I have no jealousy for this person. I respect him. But feel bad that fasting, when we all are doing, our Rishi Munis has mentioned the effect of fasting. Okay. And the Nobel Prize is gone to Oshomi, who shows that eating less gives us more robust life. So autophagy, he says that because of the fasting once in a week or intermittent fasting, okay? So type 2 diabetes, infectious diseases, immunological diseases, neurodegenerative, there are so many diseases including cancer. The fasting, one thing. So fasting is very essential. Now let us see how fasting works. He is my guru, Dr. Devchand Gala. I'm trying to learn Ayurveda since 1990. He is a fasting guru. I have seen amazing result in rheumatoid arthritis and so many autoimmune diseases treated by him with the help of fasting and Deepak Pachan. So westernized diet causes cancer. Yeah. So outcome of the fasting, experimental, in vivo and in clinical. Okay, calorie restricted diet, intermittent fasting, alternate day fasting, short term fasting and long term fasting. One thing is good about westerners that they everything they test, they try to, they validate, they accept but they try to validate. This is good thing. So they have seen the effect of fasting, all this kind of fasting, and they found that there is a modulation of aging process, effects of calorie restriction. Because of the fasting, there is a increased DNA repair, less chances of DNA damage. And we all know that cancer is because of the DNA damage or because of the environmental factors like overeating and all those dietary things which we saw. So if you do fasting, body goes in a mode of autophagy, removes all those dirt, improves the heat shock protein, improves thermogenesis, and DNA repair happens, and cancer chances, recurring chances are prevented. 36% reduction in metastasis due to down regulation and reduction in insulin-like growth factor 1. Is there any drug which can give this much reduction? There is no drug, I suppose. I may be wrong, but one fasting, no drug treatment. Okay, there is a 36% reduction. This has to be done continuously. Okay, not in 1 day or 2 days. Okay, so because of this, there is a reduction in the insulin like growth factor 1, interleukin 6, tumor necrosis factor alpha, C reactive protein. All these inflammatory cytokine load is reduced, and which actually reduces the metastasis. These are responsible. As I showed you in the first slide, that chemotherapy increases the inflammatory cytokines and causes target damage and permeability and recruits the bone marrow to produce more cancer cells. So fasting acts at all these 3 stages. It upregulates, fasting upregulates all these aldolase A, DNA, PK, phosphokinase and P53 pathway. P53 is very essential, which is suppressed in the cancer, is augmented because of the fasting. Tumor growth oncogene, this is journal, it causes increased mitochondrial biogenesis. Healthy mitochondria are generated. So Deepan Chikitsa, you can consider the previous one as a Pachan. So increase mitochondrial biogenesis, increase autophagy in the healthy cells, increase apoptosis in the cancer cells, errors in DNA replication are reduced, reduction in the migration of toxic gut mucosa associated lymphoid tissue. What a wonderful effect. Our body, we eat everything, and in order to kill the toxin, body is producing toxic lymphocytes. These toxic lymphocytes, if they cross the intestinal and blood barrier, it enters and goes into the system, and it causes inflammatory diseases like rheumatoid arthritis, SLE, and so on and so forth, and also the cancer. So because of the fasting, this gut associated, mucosal associated lymphocyte inflammation is reduced. So is cancer and other inflammatory diseases are also reduced. This is the result, the reason why rheumatoid arthritis patients they respond better when you give them controlled fasting without causing any protein loss, without causing any muscle loss. Fasting to be given Langhan without affecting the bulk of the patient. If you are reducing the bulk, the strength of the patient, that is a wrong fasting. Okay, this is what clearly written in Ayurveda also. So, and reducing cellular senescence. So cells become young and robust. Now, I know that Dr. Pratibha and Asavari and Dr. Lal Hingorani, and there are so many things they want strong evidences. Okay, so this is the biopsy evidence. Okay, I am trying to give a maximum evidences. So those who have done fasting and the biopsy of those muscles were done, they found their insulin sensitivity is increased, insulin resistance is reduced. When I say insulin resistance is reduced, automatically your insulin-like growth factor is reduced. Your sugar is metabolized in a proper way. There is no accumulation of excess sugar in the blood. There is no hyperacute insulin surges which are responsible for all kinds of inflammation. So these are the markers of mitochondrial biogenesis. This is the biopsy evidences. Uncoupling protein increases. This uncoupling protein is very essential to generate heat. We Indians, wherever you are in Europe or USA, wherever, we Indians basically have very low amount of uncoupling protein. Our uncoupling protein, unfortunately, is not working properly. We will discuss sometime why it is so, and because of which there is a reduction in the thermogenesis, and that's why we are more having dyslipidemia and also cancer so because of the fasting, uncoupling protein 3 is increased, thermogenesis is increased, and cancer chances and inflammation chances are reduced. So we have seen that the drugs which are working on Agni are also working on mitochondria. One is we saw fasting. Now these are the new class of drugs. Mitocons are the new class of drugs in drugs. So in modern science also there are drugs which act on mitochondria, but there are various dangerous side effects. So they are trying to find out if there are some natural agents which can target mitochondria in cancer, and this is the latest journal, International Journal of Molecular Sciences. Okay, so these are the authors. Mitocons, a category of drug known to precisely target the cancer cells mitochondria. So what are those? You'll be surprised. Dipan Pachan, same. Ginger, Andrographis, Calamega, Cissus quadriangularis, curcumin, Ashwagandha, berberine. So all these berberine is tikta kashai, curcumin is tikta kashai, ginger is katu tikta, andrographis is tikta katu, cissus again is a tikta katu, curcumin tikta kashai. So all these are, and these are the different classes. Andrographis falls into class 2. You can read further in this paper, which is, I think Dr. Pratibha will share my PPT with you all. So you can read in detail about this paper. So these are the class 2, berberine like a class 2, ashwagandha is class 3, curcumin falls in class 1, class 2 mitocons, and cissus in the class 2 mitocons. So these are the drugs which I said work on Agni, and now modern science have proven that they act on mitochondria and they are called mitokines. Okay. So gingerol improves ectopic lipid accumulation, mitochondrial dysfunction, and insulin resistance in skeletal muscle. Friends, is there any mitochondrial marker? Yes, there is a mitochondrial marker called 8-hydroxy-2-deoxyguanidase. 8-hydroxy-2-deoxyguanidase. In cancer, and wherever mitochondrial damage is more, this 8-hydroxy-2-deoxyguanidase is very, very high. Okay, so very high, and this can be assessed very easily in the urine. So if someone is having high amount of this 8-hydroxy-2-deoxyguanidase, it means mitochondrial function is hampered. You give ginger and this 8-hydroxy-2-deoxyguanidase reduces. Why not to use this simple test and find out whether patient is going with the abnormal mitochondria increasing or healthy mitochondria retained, which we can do it. Okay. This also predict cancer risk if higher in the urine, higher chances, easily accessed by the urinary screening by HPLC. So ginger extract considerably reduces 8-OHDG. Okay, this is Journal of Ayurveda Research 2017. Effect of ginger on inflammatory markers, a systemic review and meta-analysis of randomized control trials. So ginger again reduces inflammation. We called Mahaushadha. Ginger is called Mahaushadha. It reduces inflammation. You can give ginger in a various form. You can give ginger powder. If patient is of a kapha prakruti, you can give ginger juice, you can give ginger powder. If he is of a pitta prakruti, you can mix ginger powder with the sugar. If he is patient of a vata prakruti, you can mix ginger with the ghee or oil. Or the season is bad, weather is rainy season, you can mix ginger with good, that is jaggery and herde. So various ways you can give ginger and you can reduce the side effect of the ginger, because you have to use ginger in a large quantity. Then only you will get result. And ginger, it generates heat. It may cause bleeding also if you give in a large quantity to pitta prakruti patient. So take care of that. Fresh ginger many times does not cause side effect. Dry ginger powder causes side effect. So use according to your judgment, the prakruti assessment of the patient. Okay. If Agni is good, I mean to say the digestive fire is good, you can give ginger growth also. Just a bit. This is why it is coming. Okay. So ginger and the purified components as cancer chemopreventive agent. I'm just going through it. This is molecules of journals 2019. Ginger extract inhibit human telomerase reverse transcriptase and see myeloid this cancer expression in lung cancer cells. So telomerase, if there is a cap on our gene. If that is reducing, that gene become abnormal. Ginger prevents that. So your aging is prevented, and aging is one of the causes of the cancer. So ginger keeps you young. Okay, this is what written in Ayurveda also. Then next is piperine, pippali, again a Dipan and Pachan drug also. So piperine basically acts on all kinases, cyclin dependent kinases. Whenever, as I said, P53 is suppressed, whenever there is an abnormal cell, what happens in a normal course? P53 is stimulated. P53 will stop the cell cycle G1S, S2M. P53 will repair DNA. If repair is done, then it will continue that cycle. If repair is not done, P53 will kill that cancer cell, that is called apoptosis. So these are the three stages. Okay. What happens in the cancer? P53 is not working. It is not able to control. Okay. And all these kinases are produced in a large number. All the cyclin dependent kinases, cyclin E, cyclin DK2, all these are produced in a large number and they proliferate the cancer cycle, the cellular cycle. Piperine exactly arrests all these cyclin dependent kinases. Okay. Because of which your growth is arrested. Most beautiful thing, piperine acts on the cancer stem cell. These stem cells, they have a self-renewal property. So this piperine arrests them. Okay, so ginger and piperine. Okay, so Suntha, Kali Miri, Pimpri, Trikatu. Simplest thing everyone is having at his family. Start oncopreventive first stage treatment in a small quantity. Titrate slowly to the level you can digest. Okay. So cancer stem cells are prevented because of the piperine. The next is plumbagin, Pitraka. This is published in OncoTarget. Plumbagin works very good in HER2 receptor positive cancer, which are very aggressive, breast cancer or ovarian cancer or whatever. So Chitraka again is very good, but use very cautiously because Chitraka is in Shrotha Adhikar, it is written Chitraka Ghruta to be used. Which Ghruta? This Ghruta doesn't contain Punarnava and Gokhru. Generally, for inflammation, we use Punarnava and Gokhru, but Chitraka Ghruta, it contains Chitraka, Giloy, Dashmul, and it reduces inflammation, improves thermogenesis. Okay, HER2 receptors, it suppresses HER2 receptors, and because of which the proliferation is affected. So plumbagin suppresses the invasion of HER2 overexpressing breast cancer cells through inhibition of this again kinase mediated NF-kappa B activation, nuclear factor kappa B activation. Novel curcumin derivative 1 gram induces mitochondria and endoplasmic reticulum space-dependent apoptosis in cancer cells. So all these drugs are useful to work on Agni and mitochondria. Okay, thioreductant reductase. So curcumin is pro and antioxidant. Because of the curcumin, free radicals are increased. Understand one thing: free radicals, they are good up to certain level. Many chemotherapeutic drugs, they increase, they augment free radical. Cancer cells suppress free radical. Cancer cells suppress free radical. Okay. And chemotherapy, because up to certain level, when free radicals are increased, it generates death signal. It stimulates death signal. Okay. That's why chemotherapeutic agents generate increased free radical. And that's why oncologists say if you are on a chemotherapy, don't take antioxidant. Now, curcumin is a pro and anti both. It acts on thioreductase, this TRXR2, and because of which free radical production is increased as a pro-oxidant. That's why curcumin synergistically act with the chemotherapy, and it removes all unhealthy mitochondria and all those unhealthy, inflammatory cytokines. Okay. Vidania somnifera enhances chemotherapy through priming. Okay, so again, if you give ashwagandha, so those cells are primed in a way so that chemotherapy radiation works very fast. So this is called priming effect. You can read this paper. Okay, vinaferin A mediated apoptosis in a breast cancer cell is associated with alteration in mitochondrial dynamics. So all these papers are available. Okay, so you can go all these things, and they all have a good effect on mitochondria. They remove unhealthy mitochondria. They make cell more prone to be damaged by the chemotherapy. Unhealthy cells. They do not act on the healthy cell. This is the beauty of all these herbs, because through they act only on certain receptors which are more on the cancer cell and not on the healthy cells. Okay. Now this again trial done, Dr. Lal Hingorani's Ashwamax was used, and they saw that the cancer stem cells were killed by this ashwagandha. So there is relapse was prevented. This was done in USA 2000, I think 12. Dr. Lal Hingorani will tell you more about it. So initial tumor, give chemotherapy, cancer stem cells do not die, rest of the cells are dying. You give ashwagandha, the cancer stem cells die and there is no recurrence. Okay. Again, vitapherin A and sorafenib, when you give, it works synergistically, and 89% necrosis was found. No side effects. Okay. Again, ashwagandha was given along with paclitaxel. Okay. By the way, paclitaxel, comfetericin, vinca alkaloids, and podophyrotoxin, these all are derived from herbs. From 1960 to 2002, thanks to USA scientists, paclitaxel, camphotericin, vinca alkaloid, and one more, they all are derived from herbs only. So why not ashwagandha and curcumin, a next chemotherapeutic drug? Today, let us use it as an oncopreventive. Next, they are going to be a chemotherapeutic drug. Okay. Ashwagandha, he has written various how it works. These are the antioxidant, apoptotic markers. It improves apoptosis, anti-proliferative, anti-inflammatory, anti-migration. So these are all basic effects of the ashwagandha. Curcumin, this is written about Ayurveda. Ashwagandha Shodh reduces rasayan. It as a rasayana. Nisha means haldi. It is written apachi. Apachi is a pre-cancerous stage, you can say. Okay, Visha, Shodha. So all these things are written about curcumin, and modern say that NRF, which stimulates the NF-kappa B, adenosine monophosphate kinase, and all these things, they are P53 is improved, and because of which anti-cancerous efficacy happens. Vascular endothelial growth factor, NF-kappa B is reduced. mTOR receptor, very essential, mammalian target of rapamycin. This is suppressed. So because of which the cancer proliferation, cancer spreading doesn't happen. If NRF is more, NF-kappa B reduces. If NRF is less, NF-kappa B is more. So it increases NRF, NF-kappa B is reduced. Okay. So these are the some things, which I have just formulated, how the herbs have efficacy, which causes apoptosis, proliferation, which acts caspase 3,9. So cannabis acts here. So this is just a summary of what I spoke. Okay. Now coming to a very important topic on CBD. Okay. Is it okay if I talk on CBD, Dr. Pratibha, or should I skip it?
No, sure.
No,
Actually,
Go
yeah,
ahead.
please go ahead.
Please go ahead.
Okay. So, CBD is, being derived, that is cannabidiol is derived from the cannabis, that is bhanga, what we call. So, regulatory effect of cannabidiol on mitochondrial functions. So, I have summarized. So, this CBD basically, cannabis has got hundreds of cannabidiols, of which CBD and THC, they are the main. And then there are certain other CNN, CBG. So Syed Tahir Hassan is the best person, and he has done extensive study on this. I don't know whether he's attending the lecture or not. I have requested him to be here. So the CBD, it acts, CBD is a non-toxic. CBD will not give you high. Okay, CBD is very safe. CBD is relatively safe than the THC. CBD acts on the periphery. THC acts on the brain, CB1. CB2, all body, immunity. So CBD acts there. So CBD modulates mitochondrial function, respiration, and biogenetics. CBD modulates mitochondrial fission. So if smaller the mitochondria cancer increases. CBD makes them larger. So fission is arrested. Fusion is improved. Okay. It modulates mitochondrial DNA epigenetics. Okay. Mitochondrial cellular calcium and ferritin concentration is improved because of the CBD. Okay. And mitochondrial intrinsic apoptosis. So mitochondria also works as a death signal. When cell is not functioning properly, mitochondria generates cell signal. Through some ligands, it works and the cell dies. So that's why we say that mitochondria is responsible for the birth and the death. So Brahma, Vishnu, Mahesh is mitochondria. And CBD, again, which is a symbol of Lord Mahesha, it disrupts, okay, the unhealthy mitochondria. Many people, they confuse bhanga with afim. So this is bhang, not opium, not afim. Okay, bhanga kafara tikta grahini pachani lagu. This is a Sanskrit shlok, pittala. So be careful. It is little heaty. Okay, moha mada vaga vanni vardhini. Vanni means agni vardhini. It improves the agni. That's why bhang is useful. Use it cautiously. There are very good results are there. So Dr. Syed Tahir Hasan, who infused me with the scientific knowledge on cannabis. Okay, so cannabinoids as anti-cancer drug, current states of preclinical research. So cannabinoids induces apoptosis. This is the summary of this trial. It inhibits tumor invasion, metastasis, inhibits proliferation, angiogenesis. It improves immunity, induces apoptosis, induces autophagy. How it is done? So human body has got CB1 and CB2 receptor in abundance. CB1 is basically, you can see, is there in the brain here. Okay, all motor activity, thinking, all these things are because of the CB1 receptor plays very important role. CB2 receptors is very largely present in gut, kidneys, pancreas. So, CBD is very useful for gut cancer, kidney cancer, pancreas, adipose, skeletal muscle cancer, bone cancer. Wherever CB2 receptors are in predominance, your CBD will work. Okay, and fortunately, everywhere CB2 is there. So use CBD. CBD is non-toxic, doesn't cause any kind of euphoria or any kind of high. So CBD is very safe to use as per my personal experience. So again, this these are the receptors through where CB1 enters into the body. So dysregulation of endocannabinoid system has been associated with several diseases like neurodegenerative diseases, multiple sclerosis, inflammation, epilepsy, schizophrenia, glaucoma, cardiovascular disease, and obesity and cancer. This is from International Journal of Molecular Science 2020. So mammalian endocannabinoid system receptors, ligands, and enzymes. So I will not go into the details. The CB1 and CB2, these are the two main. What are the endogenous ligands? Anandamide, they were discovered in 80s, very early, and 2-arachidonyl glycerol, 2-AG. So these are all, endocannabinoid system. Imbalance of this, if there is a low amount of CBD, okay, so it prones the person to develop inflammation. Now, how CBD works, that it acts, reduces proliferation through all these receptors, through all these kinases. It causes again apoptosis, okay, through all these receptors. It generates certain kinds of toxic substance inside, and because of which, the cancer cells die, okay. And it also stimulates the autophagy. So because of which, the cancer cells die. These are the various modes of action of cannabis. So the cancer cells, epithelial to mesenchymal transmission, the normal cell becomes cancerous. This is called EMT. Okay, so cannabis prevents through various these receptors and fibers this epithelial to mesenchymal transition. Very, very essential. So in a tumor cell, if there are 70 cancerous cells are there and 30 normal cells are there, so cancerous cell will try to make those healthy cells to a cancerous cell, and cannabis prevents this epithelial to mesenchymal transition. Cannabis also disturbs the angiogenesis, because of which cancer cells are not able to circulate and invasion is affected. So cannabis, when you give slowly the isolated CBD without THC, if you give of the good brand, there are no side effects, no organotoxic side effects. After using cannabis on 2000 patients and 410 cancer patients, this much confidence I have acquired. Not a single patient has developed any kind of organotoxic side effects, and I have a meticulous data presented in my laptop and in my pen drive. Okay. Then what cancer cells the cannabis do? It kills the cancer cell and present it to the macrophage. Cancer will try your macrophage to make, M2. So M2 is a dull macrophage, which will not kill cancer cell. But when you give cannabis, and this cannabis killed cancer cells are presented to the macrophage, macrophages turn M1. This is what we want. So M1 turn macrophages, they kill cancer cells. So this is how, one of the effects of cannabis was found in the experiment. This is just yesterday only Dr. Syed Tahir shared this. original 2021, a novel mechanism of cannabidiol in suppressing hepatocellular carcinoma by inducing GSDME dependent pyroptosis. So this is a different way of killing cancer called as pyroptosis. I have not gone into the detail. I need to read this article thoroughly, but this is what is pyroptosis is. So because of the pyroptosis, in gold nanoparticle, they cause microptosis. So they act on the microtubules of the cancer, and microtubules, they form the skeletal of the cancer cells. So they are killed. So this CBD causes pyroptosis, and because of which, cancer cells are killed. Friends, there are more than 2000 articles, 96 clinical studies are being done. This is published Journal of Clinical Oncology 2021. Two randomized control trial. After that, many other more must have been done. So, there are various studies of safety and efficacy are being established. One study we have done in Tata Memorial Hospital. This is our study. The aim was to explore the anti-cancer potential of cannabinoids compound. So we found very safe. It was to only establish safety and efficacy. So inclusion and exclusion criteria, I will not go into the detail, but the outcome says that the dose what we use up to 5 milligram, then we titrated 10, 20 and 30 milligram. So 10 milligram of CBD and 10 milligram of THC did not cause any kind of, major side effect. So this was a dose limiting toxicity. More than 10 patient did not tolerate. Of course, it's a short duration treatment. If you slowly increase, patient can tolerate even up to 90 milligram. This is what we have seen in a clinical practice. Okay. So in a
So
hospital
Nitin,
setup.
Dr. Nitin,
I
sorry
will
to
wind up.
interrupt. So no. I was just going to propose a part 2 next week, same time, if
Yeah.
possible.
Mine is over.
Because we don't want to miss anything, and
Okay.
we're just wondering if recording space may run out or something.
Okay, so you want me to stop here?
I'm just I would like to ask you, are you available next week, same time?
Next week, same time, Thursday. Yeah, I'm available.
Okay. Is it okay then we invite Dr. Lal Hingorani and
Yeah, we
anybody
can
else?
invite.
Okay.
You want Dr. Lal Hingorani to continue now?
We would love to hear him fully, but we would love for him to make a small, whatever he has prepared now, maybe 5-10 minutes. Is that okay?
Dr. Lal, sir?
Yeah, that is okay.
Thank you
So
so
I'm
much.
I'm sharing the slides. You can just go through it.
And we will definitely announce a part 2, everybody who is attending, next week, same time, because we
Sir,
want
from here you can start.
everything. Okay. Thank
Or you
you.
want to share your slides, Lal, sir?
I'll do it next week. My slides are there, almost 27 slides are there.
See,
So I
that would be
also-
lovely. Yes,
I
thank
have,
you.
I'm also very much tired because I'm working from 2 a.m. today.
Yes,
And
that's what I
traveled to
thought.
Delhi and then
So
came back.
Dr. Pratibha, should I finish mine? Mine is 5 minutes.
If Dr.
5 minutes.
Lal is okay, we can actually bring him in. I know it's very late in India right now.
Yeah,
So,
5 minutes. I'll just tell you, okay, what is the theory behind this thing?
okay. So Dr.
Or you can
Nitin will
finish whenever.
continue yours next
Yeah.
week.
Yes,
Thank you.
yes. Okay. Yeah. Yes, Lal, sir. Continue, please.
Basically, there are each and every botanical product. If you see, there are some research done on that on the cell lines, and they are very active. They show that it is killing the cancer cells. But when you go to animals, still you see some results. But when you go to humans, there is nothing in that. And it's not nothing, nowhere near chemotherapy. The results I'm talking about.
Dr. Kaushik.
So
Namaste ji.
we actually started with this thing, Dr. Manish Agarwal, as he said. He came in from US. He had done some work on ashwagandha on the cell lines. He wanted to try it in humans. But he was very clear. He said, we are not going to get any results because we were told to do the trials on stage 4 patients of osteosarcoma, very, very difficult cancer. So we just did a safety studies of those, up to what level they are safe. And then we started working on the formulations. And In Ayurveda also, a lot of formulations are there. Why they had done so many formulation, it's well known now, scientifically proven. Okay, why they were using ghee, why they were using milk, and why they were using other different kind of products. So on that basis, the allopathy system is also there. From there, we got certain ingredients and we made it bioavailable. And better NA after some time realized, because animal trials were very good, like what he was talking about, Ashwamax, it was done at Stanford for glioblastoma, and results were very good in animals. Then for Ashwagandha, again, same product, we had given it to Pittsburgh. There also it was very good results in the this thing, breast cancer. Uh, so both the products gave very good, and they wanted to go ahead with that in the human trials. So we were not doing, and I had a chance, actually, where we went successful is had a chance to meet Dr. Bharat Agarwal when I was visiting him. And he said, can I, curcumin will not work, turmeric will work. So on that basis, we designed a product which was having total all the components of the turmeric, and that we made it bioavailable. And that is a product, is the first product which is gone for phase 2A, is complete now in USA. So for oral cancer, 14 patients were taken. All the 14 patients got a positive result. Positive means I'll just, if you give me a chance, just one slide I'll show you. Oh, then I'll end up, because
Yeah, Dr. Nitin, do you want to stop sharing? I don't know.
Yeah,
Push.
sir, I can stop here.
Yeah.
From
So
here.
just click stop sharing, and then Dr. Asafri, can you give Dr. Lal Hingorani co-host to share?
Yeah, sure. Let me do that.
Thank you.
Mhm.
This is really
yeah,
valuable. Yeah, thank you.
I'll just phase 2 mein what we did is this 14 patient ka result is there. Uh, So generally, whenever the person goes with a, they have a this thing, head and neck cancer, he goes to the doctor. They put him for the surgery. Surgery sometimes takes almost a month till he gets a time for the surgery. So in that time frame, it increases by 1.3% every day. So that was we wanted to stop that. So for 6 weeks, we gave this turmeric pastils to put it in the mouth, almost 6 pastils in a day. And if you see the results of the 14, one of the patient, 100% tumor was gone. Other patients, 33, 31, 22% reduction, 13%, 3.8. None of them were above the threshold limit, what is called. It's about 20%. And one of the patient only had 3.6% increase, but other was like 0%. So this is considered very good, because when the surgeon is doing the surgery, he gets a smaller tumor to be removed, which is much easier and all these things. So that was a thing. And this is now going for a phase 1A for glioblastoma also, because during this time, one of the patient who was in the same hospital had a glioblastoma. She was given, after the permission from FDA, this product along with the chemotherapy, and she got cured. Otherwise, she was not with the chemotherapy, nothing was happening to her. So these things are like a came as a miracle to us. Uh, was not, because we had actually changed our route from treating the cancer to seeing that with these botanicals or Ayurvedic products, how we are able to reduce the toxicity of chemotherapy. And our lot of work is on that, mucosatosis, fibrosis, then your immunity building during the chemotherapy. All these other trials are on that now. But this was a luck by chance. I met this Dr. Bharat Agarwal, and then he put us in the directions like he says, purification does not mean it will give you results that way. So just wanted to share with you. I can share all these things, different products that we have done, the animal trials and all these things. I'm not an oncologist. I'm not like even an Ayurvedic physician. The way Dr. Nitin was speaking, it's a little difficult for me to use all those words. I understand that, but I am not a expert in that. So mine will be mainly how we developed the product, and these oncologists did their job. Thank you. I think we can continue next week with a total
Thank you.
listing presentation.
Thank you. Thank you, Dr. Lal Hingorani. Thank you, Dr. Nitin Kochar. Everybody who has attended, taken time to attend. We will have a part 2 on next Thursday, which is Thursday IST. And yeah, same Thursday. No, it's Wednesday for us. And Thursday for you. So it's a different
Yeah.
day. I think it's March 7th, Dr. Hasavari?
Yeah, that's
We-
right. And it
we
will be
will-
the same day. It will be the same day for us. It will be Thursday morning for us, and it will be Thursday night for them. Like for
Right.
yeah.
Right. So please mark the date. We will share a new Zoom link. And my request is for Dr. Nitin and Dr. Lal Hingorani, if you can also include some information and data about metastatic cancer. That would be really helpful, because that is the stage in which a lot of patients actually come to us. Is there anything that you have found to be effective in an integrative manner or purely Ayurvedic manner? That would be, if you can shed some light on that, that'll be great. And we will keep the next session also 90 minutes. Beforehand, we are announcing, so it's not going to be 60 minutes. Please prepare for 90 minutes, because this is a lot of valuable information. So thank you so much, and
Yeah.
namaste.
Thank you. Thank you very much.
Thank
See you
you
next
so
week.
much.
To you all.
Thank
Yeah.
you.
Next week.
Thank you.
Thank you. Thank you.
Thank you.